Hi, my name is Marie Scudder. I am a nurse practitioner student in the acute care nurse practitioner program at Arkansas State University. I'm going to do my 360 room scan. So you can see I have my supplies over here that I'll be using by the bed. That is a ruler, a blank index card, and my pen light. I've got my stethoscope. Here is the room all the way around. I have a book on my table that I'm going to be using to help prop my camera. Okay. And then I also have my card, my cue card. All right. So I'm going to start by the inspection of the chest. I'm washing my hands. I'm donning my gloves. I have introduced myself to my patient. I'm going to walk around for inspection. I'm looking at all sides of his chest, anterior, laterally, and posteriorly. I'm looking for any obvious signs of deformities, any use of accessory muscles in his breathing. I'm going to take a deep breath for me here, looking for his expansion. As you can see, he is in no signs of acute distress. His breathing is about 16 times per minute. His breaths are regular and effortless. They're even and unlabored. He is not using any accessory muscles. He does not have any deformities. He does not have any retractions. No accessory muscle use. No signs of barrel, pigeon, flail chest, or funnel chest. His lateral AP diameter, the lateral is greater than the AP. And then as I was walking around, I noticed that his chest is symmetrical with no lag. Okay. Now I'm going to palpate his chest, and I am just checking for any bruising, lesions, or tenderness. Okay, I'm going to just spin around, and I'm going to do the same on the back, and I'm just looking for any signs of bruising, lesions, or tenderness. All right, I'm going to flip you back around. The next thing I'm going to do is I'm going to percuss, and I am going to be striking with my middle finger, and I'm going to have my other fingers off the chest, and I'm going to be hitting the distal interphalangeal joint. And I am going in a ladder pattern. And I am going to check the laterals. I'll get you to spin around, and I'm going to do the same thing on the back side. And I'm just listening for any dullness or hyperresonance. And the predominant sound is just resonance. All right, now I'm going to flip him back around, and I'm going to auscultate his breath sounds. I'm auscultating with the diaphragm. I'm going to have you just take breaths with your mouth open for me while I auscultate. Listen to his laterals. All right. Spin around for me, and then cross your arms like up across. Yep, there you go, and keep your mouth open while you're breathing. Okay, so I'm doing a ladder pattern on the auscultation to ensure that I'm able to compare side to side. I'm auscultating for any adventitious breath sounds, which I did not hear as breathing is clear on auscultation. Some adventitious sounds that we could have would be like crackles, rails, ronchi, wheezing, that kind of stuff. The next thing we're going to do, we're going to move down here, and I'm going to get him to lay in the bed. And we are going to reprop the camera. There we go. And I'm going to get you to lay with your head on pillow, so we're at about a 30-degree angle. And the first thing I'm looking at, turn your head this way. I'm using tangential lighting. Turn it back this way. go. You don't have to go so hard. There we go. Okay, and I'm looking for the JVD with the tangential lighting. I'm gonna measure his JVP, and I'm going at the sternal angle, and I'm looking for the pulsations, and we're about at 2 centimeters. All right, the next thing I'm gonna do is I'm gonna check his carotid pulses, and I'm just gonna feel. Okay, and I'm just palpating. All right, his carotid pulses are 2+. I did not feel any thrill. Now I'm going to palpate the PMI. And I am just going to use my finger. It's between the 4th and 5th intercostal space at the midclavicular line. The next thing I'm going to do from here is I'm going to auscultate the 5 cardiac areas. I'm going to do each with the bell and the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. With doing that, I'm listening for any, for the rate and the rhythm and for any extra sounds. His rate and his rhythm is regular. He's beating at about 68 beats per minute. I did not hear any S3, S4, any murmurs, gallops, or rubs. I'm also going to auscultate for carotid bruit. All right, turn your head a little bit and hold your breath. All right, turn this way. All right, and I did that with the bell. I did not hear any carotid bruit. All right, so the next thing that I'm gonna do is I'm gonna put my stethoscope down, and I am going to look at his peripheral vascular. I'm looking at his legs, groins to toes. So I am checking all the way down. I'm checking anterior, posterior, and laterally. I'm looking at his hair distribution. I'm looking at the color of skin. I'm looking on his feet and his toes. His hair is distributed over his legs and his feet and toes evenly. I do not see any signs of like rashes, ulcerations, pigmentation, wounds or lesions or anything like that. I'm looking at the soles of his feet. There are no discolorations, rashes, lesions, or wounds, ulcerations. I'm feeling the temperature, his leg, feet, and soles of his feet and everything. The skin is warm, dry, and intact. I'm actually gonna do some hand hygiene, and I am looking at his cap refill in his toes, and it is less than 3 seconds. His nail beds are pink. There's no clubbing or anything like that, no pallor. I am going to palpate his pulses. I'm going to palpate the femoral. I'm palpating his inguinal lymph nodes. I'm going to palpate his popliteal on both legs. I am palpating his posterior tibialis, which is right here behind the ankle bone on both sides. And I'm going to palpate his dorsalis pedis. All of his pulses are 2+. I did not feel any thrills. The lymph nodes, I was checking for size, shape, consistency, and mobility. I did not notice any like rashes, wounds, lesions. His color is appropriate for his ethnicity. The skin is warm, dry, and intact. All right, so the next thing that I'm going to, and I'm going to check for, there's no swelling or edema throughout, but I am going to check for pitting edema by doing, pressing my thumbs in on his shins for 5 seconds. And then I'm going to do behind the medial malleolus in about the posterior tibialis pulse area. I'm going to press there for 5 seconds. And I'm pressing on the dorsal of his feet for 5 seconds. And he has no pitting edema. So the next thing that I am going to do is verbalize the breast exam for the male and the female. We're going to start with the female. So for the female, for the inspection portion, I would have her just sitting on the table with her hands to the side. I'm going to inspect bilateral breasts for the color, the size, the shape. I'm looking for any thickener in enlarged pores. I'm looking for any dimpling. I'm going to inspect the nipples. We're looking for size, shape, direction, the contour, and inversions and discharge. I'm going to do those inspections, the visual inspections, in 3 different positions. One with her hands behind her head, one with her hands on her hips, and one with her leaning forward. Then I'm going to palpate. And for me to palpate, I'm going to have her lay in supine. I'm going to get her to put her ipsilateral hand behind her head. And I am going to use my 2nd, 3rd, and 4th fingers. And I'm going to palpate in small concentric circles in a vertical strip pattern to make sure that I do not miss anything. I am palpating for consistency, tenderness, nodules. I will palpate the nipples for elasticity and discharge. For the male breast exam, I am going to have them sitting. We're looking inspection-wise for like the discoloration, nodules, ulcerations, edema, gynecomastia. I'm going to palpate the breast tissue and the areola, and I'm going to be looking for the differentiation between like the glands, the glands and the soft tissue. And I'm also looking for like tenderness and nodules when I'm palpating for the breast. I'm going to have you sit up, and I am going to swing your legs off the bed. I'm going to inspect his axilla, and I'm looking bilaterally. I'm going to do an inspection, and I am looking for like any discolorations, any lesions, any masses, any things like that. I'm going to inspect, I'm going to palpate for his lymph nodes. I'm going to hold his arm like this, and I'm going to use my left hand, and I'm going to palpate his central lymph nodes, his pectoral lymph nodes, his lateral lymph nodes, and I'm going to do the same on the other side with his left hand, or left one. I'm going to use my right, and I'm going to palpate and slide down. I'm palpating the pectoral. This is the central lymph nodes, the pectoral, and the lateral. I'm also going to palpate his supraclavicular, which are above the clavicle, and the infraclavicular lymph nodes. With those, I am looking for the consistency, the size, the shape, the mobility, and if there is any tenderness. And then I'm going to have him stand up, the last thing I want to do, and I'm going to check his legs for any varicosities, which I do not see. And that's it.